A seizure looks like an emergency happening to someone's whole body. But the 2 minutes right after it starts are almost never about medicine. They're about what the person standing next to them decides to do. Most bystanders freeze or do exactly the wrong thing. They try to hold the person down or shove something in their mouth to stop them from, quote, swallowing their tongue, which isn't even physically possible. In the next few minutes, the 4 things you do in the first 2 minutes of a seizure, the exact number of minutes that turns a seizure into a true emergency, and the myth that sends bystanders home with a bitten finger instead of helping the patient. This is first hour, and today, seizures, and why the first 2 minutes matter more than anything that happens after the ambulance shows up. A seizure happens when a sudden burst of abnormal electrical activity fires through the brain, like a power surge racing through a circuit that's built for a steady signal. That surge can make muscles stiffen and jerk uncontrollably, called a convulsive seizure, or it can just cause a blank stare and a brief loss of awareness, called an absence seizure, with no shaking at all. Seizures aren't always epilepsy. A single seizure can come from a high fever, a head injury, low blood sugar, a stroke, alcohol or drug withdrawal, or dozens of other causes. Epilepsy is simply the diagnosis given once someone has had 2 or more unprovoked seizures. It's a tendency, not a single event, and it affects millions of people in the United States alone. Either way, in the moment, your job isn't to diagnose why it's happening. Your job is just to keep the person safe until the electrical storm passes on its own. Some people get a warning first, called an aura, a strange smell, a rising feeling in the stomach, or a sudden sense of fear or déjà vu, seconds before the seizure actually starts. During a convulsive seizure, the body typically stiffens first, called the tonic phase, then jerks rhythmically, called the clonic phase, and together, that's the picture most people imagine when they hear the word seizure. You might see the eyes roll back, the jaw clench, breathing turn loud or briefly stop, and sometimes a loss of bladder control. It looks terrifying, but most of that, by itself, is not dangerous. Watch closely for a few things. Is this the person's very first seizure ever? Is it happening in water? Did it follow a head injury? Each one changes what you do next. And start a mental clock the second it begins, because the single number that matters most today is how many minutes this seizure actually lasts. Here's the fix. First, protect their head. Ease them to the ground if they aren't already down, and slide something soft, a jacket, a bag, anything, under their head. Second, clear the space. Move sharp or hard objects away from their arms and legs so the movements can't cause injury. And don't try to physically stop the movements themselves. Third, turn them onto their side, into the recovery position, as soon as you safely can, even mid-seizure if there's any fluid near the mouth. This keeps their airway clear. Fourth, time it. Out loud if you can, starting from the very first second of movement. Check a clock or your phone the moment it starts, not after you've already been watching. A mile a while. Thank them for ono and adonunajijand or what. Do not put anything in their mouth. Do not restrain their arms or legs. Do not give them water, food, or medication until they are fully awake and alert again. A seizure that lasts 5 minutes or longer is no longer just a seizure. Doctors call it status epilepticus, and it is a full medical emergency. At 5 minutes, call 911, even if you're not sure, even if it's someone's first seizure and you don't know their history. Don't wait to see if it stops on its own. Also call 911 immediately. No 5-minute wait required if this is a first-ever seizure. If seizures repeat back-to-back without the person waking up in between, if it happens in water, or if breathing doesn't resume afterward. Here's why 5 minutes is the line. Past that point, seizures often will not stop without medication, and every extra minute raises the risk of lasting injury to the brain. Once 911 is called, keep timing and stay with the person. Tell the dispatcher exactly when it started and whether this is a first seizure or a known seizure disorder. If you know the person has epilepsy and carries rescue medication, like a nasal spray or gel prescribed for prolonged seizures, now is when it gets used, following their existing care plan. When paramedics arrive, they may give a fast-acting anti-seizure medication through the nose, cheek, or an IV, aimed at stopping the electrical storm before it causes more damage. At the hospital, doctors look for the underlying cause: blood sugar, infection, fever, drug levels, or a stroke, often with a brain scan, especially if this was a first-time seizure in an adult. Once the seizure stops, most people enter a groggy, confused recovery period called the postictal state. This is normal, can last minutes to over an hour, and just needs you to keep them safe and calm. Myth: you can swallow your tongue during a seizure. False. It's physically impossible. The tongue is attached at the back of the mouth and cannot go down the throat. Myth: you should hold the person down to stop the shaking. False and dangerous. Restraining someone mid-seizure can dislocate a shoulder or break a bone without stopping the seizure at all. Myth: put a spoon, a wallet, or your fingers in their mouth to protect their tongue. False. This is how bystanders end up with bitten fingers and how patients end up with broken teeth or a blocked airway. Myth: a person having a seizure is dangerous to the people around them. False. A seizure is a medical event happening in the brain. The person isn't choosing their movements, and they aren't a threat to you. Myth: once the seizure is over, they're fine, no doctor needed. False, especially for a first seizure. Even a short seizure deserves medical follow-up to find out why it happened. Febrile seizures happen in young children, usually between 6 months and 5 years old, triggered by a rapid rise in fever. Most last under 5 minutes and look terrifying, but usually aren't dangerous. For a febrile seizure, lay the child on their side, clear the area, time it, and do not use an ice bath or cold water to try to cool them down. That doesn't prevent seizures, and it can cause shock. Still call 911 for a febrile seizure past the 5-minute mark, or if it's the child's very first one, exactly like you would for an adult. Epilepsy affects millions of people in the United States, and status epilepticus alone sends tens of thousands of people to emergency rooms every year, with real risk of death the longer it continues. Seizures can also be triggered by heat stroke, alcohol, or drug withdrawal, dangerously low blood sugar in someone with diabetes, or a head injury. The first aid stays nearly identical no matter the cause. Quick recap: protect the head, clear the space, turn them on their side, and time it from the first second. Nothing in the mouth, no restraining, no water until they're fully alert. The one number to remember is 5 minutes. Past that, or with any first seizure, repeat seizures, water, or breathing trouble, call 911 immediately. We built a free, printable seizure first aid checklist: the steps, the 5-minute rule, and the myths, all on one page. At firsthour.com. Link is in the description. If this helps you protect someone through the worst 2 minutes of their day, subscribe to First Hour for weekly emergency preparedness videos and share it with a teacher, a coach, or anyone who works around kids. Stay ready, stay calm, save a life.